Historically, suicide has been seen as something that is exclusively in the mental health realm, but we know that over half of suicide decedents do not have a current known mental health condition. That means that we need to move suicide prevention out of the mental health realm exclusively and into the public health realm where everyone has a role to play in suicide prevention.
In our work in Colorado, we have a legacy of really looking at common root causes that are shared across multiple forms of violence and injury. So, specifically, suicide and opioid overdose. And this makes good sense, especially in a setting where you have limited resources. With prevention, we really do have many, limited funding and limited resources going into that field. And so we really try to be strategic about how we're using our funds to, have strategies that are cutting across multiple forms of violence and injury.
The CNC is a partnership of national, state, and local public health professionals working together to implement comprehensive strategies for suicide prevention that are both data-driven and equitable.
We knew that we needed national, state, and local efforts on board to make this project work. So first, the national and state partners got together and thought about the criteria that they would need to use to identify the local partners who would implement the project. We took a look at the epidemiological data, and we noticed that there were 6 counties in Colorado that really fell out as having higher than state average rates of suicide and also high numbers of suicide, and opted to pull those counties into the collaborative to begin to produce change. Early on, the Colorado National Collaborative didn't have any formal funding. And so the folks who were on board in the collaborative in the early days were volunteers. So it was volunteers at the national level, at the state level, and at the local level. So we put a lot of effort into establishing the model together. And I think it brought us closer in terms of producing buy-in. Everyone was volunteering, and everyone knew that everyone else was very invested in the project for that reason.
The CNC identified 6 key elements or pillars of a comprehensive approach, focusing on upstream prevention concepts and strategies. And these include economic stability and supports and community connectedness, increasing education and awareness, access to responsive care and lethal means safety, and finally, ensuring that community-led postvention occurs in a coordinated fashion. And our community grantee partners use these strategies within the 6 pillars to guide their local suicide prevention efforts and prioritize funding.
The national and state partners got together with the counties and individual site visits. We looked at their data. We looked to see who is at highest risk of suicide in each of the counties. We looked at their existing prevention efforts. We looked to see what they were already implementing on the ground. Then the counties thought about their existing infrastructure. They thought about the political buy-in. They thought about their current data and their needs. And together we came up with a list of strategies that all counties agreed would be critically important to implement in order to reduce suicide.
Some of the same counties that have high overdose rates also have high rates of drug overdose. That's not surprising because suicide and overdose share a lot of the same risk and protective factors. So if we're able to collaborate to address some of the common risk and protective factors that impact both issues, we can tackle both of those important issues at the same time.
By taking a local, state, and national approach, we have access to a lot of things, including funding, including experts across the nation and across our county lines. We're able to work with people doing boots on the ground work who are implementing things that we may not have thought of. We also have the ability to have more resources, to have more funding, and to be engaged and have those brainstorming sessions that really help us know that what we're doing is the best thing for our community.
The Colorado National Collaborative requires all 3 levels. The national, state, and local partners all need to work together. They all bring different perspectives. The model requires trust building between the national, state, and local partners. Early in the model, we were primarily volunteers, and that helped establish that trust, that level of buy-in, that we all believed in this model. We were all working together. Also, the model's not a plug-and-play program. The model requires cultural adaptations, and that flexibility is critically important.
Larimer County was successful in implementing the CNC work because, one, we had funding for the first time ever that allowed us to go deep into the work. We also, through that funding, were able to get person power. We were able to have people with lived experience or professionals oversee each one of the pillars. And also, we had community readiness. We had community members and partners who were already engaged in the work and were excited about the work. And finally, the legitimacy of having the CDC and these national partners allowed even more buy-in from the community partners. And so it was really successful because of all of these things.
If you're thinking of implementing a model similar to ours, we would suggest working on relationship building to ensure that the work is collaborative. It is important that this model is inclusive of the voices, opinions, and experiences of the local community which this project is going to affect, rather than a top-down approach. The folks who have their boots on the ground, the ones who are doing the work in their own community, are the experts in what works best for them. So it's important to include them in the shared decision-making process from the start.
We've learned that partnerships are really key to this work. So just like in the name Colorado National Collaborative, we really try to emphasize that collaborative piece. And what can happen sometimes when you're doing different prevention work is that different teams, different groups, different agencies can get really siloed.
In Colorado, our suicide prevention and overdose prevention programs are located in the same division. We collaborate regularly with each other so that we know which counties are receiving funding for different programs. And we try as hard as we can to make sure that our funding and our projects are coordinated so that we have a big impact on the shared risk and protective factors. For example, we're using some of our overdose data to action funding to support activities that increase economic security, because we know that increasing economic security ensures that we'll have less suicide and less overdose within those specific geographic areas.
As an evaluator, I'm really excited about the evaluation process that the Colorado National Collaborative has taken. We've established a dashboard that allows individual counties to track their process, to tell us how many people they've served, to tell us the outcomes of those services, and to really tell the story of the Colorado National Collaborative, which is really exciting because as we think about the future of the Colorado National Collaborative, we want to be able to tell that story, be able to talk about how it works and why it works and where else it might work, and especially to think about those critical infrastructure elements that are really important to establishing the model.
The entire CNC, as the name suggests, is collaborative, which means we use a shared decision-making approach throughout the entire model, from creating the CNC pillars and strategies themselves to implementation efforts and evaluation efforts. And we understand that the best evaluations are living, breathing things that can adapt to certain circumstances. So we continue to meet regularly to discuss challenges and revisions as necessary.
Using a collaborative approach has benefited community work because it helped us redefine what suicide prevention is. It helped us go and provide suicide prevention across the lifespan and across the community. It helped us reach non-traditional partners like our housing and transportation partners. And we know that by bringing in these non-traditional approaches, we're preventing suicide across generations in our community.